on the surface co-occurring mental illness, substance use, and suicide risk. I'm joined Nicole Roger from the Director of Clinical Sales Team from Spring Health. And before we get started, I just want to explain I lead the National Labor Office. For those of you who don't know me, we are celebrating, as you can tell, our 60th anniversary. We have been working with organized labor for over 60 years in helping them access affordable health care. I also sit on North American Building Trades Opioid Suicide Awareness Task Force, where we were always looking to build awareness and solutions. Today's topic is so important because the suicide rates and overdose rates are really sky high, and they are much worse in the union space than in the commercial account. For instance, firefighters and police officers, their rates are double what we see in the commercial market. For building trades, the rates of suicide and overdose far outpace the rates of deaths due to accidents. So today's conversation is so important, and given the crisis and our focus in the National Labor Office, we have a new strategic alliance, and that is with Spring Health, who are experts in the mental health space. And I'm so happy to be joined by Nicole. I'm going to hand it over to her, and I want to thank everybody again for joining.
Great. Well, thanks for that intro, Marilee. I'm really happy to be here and talking about such an important topic. As mentioned, I'm Nicole. I am a director on the clinical partnerships and sales team at Spring Health, and I'm a licensed therapist by background and training. And my area of expertise is working with folks that are dealing with substance use disorders as well as anxiety and depression. And as we'll talk kind of throughout our time together, how all of those are oftentimes related. And then at Spring, in my role, I act as a subject matter expert and meet with employers and unions all day long to really make sure that we can tailor a mental health solution where their employees, their members, and their families thrive. So, as I said, really happy to be here. And the next slide, we'll have just a bit of a content warning before we dive into the nitty gritty. And I always like to start with this content warning. So kind of creating some psychological safety amongst us. So if folks have any questions about the content that Marilee and I will talk about, feel free to type your question into the chat. Or if you prefer to remain anonymous, you can send one of us a direct chat as well. We want to make this as conversational as possible. This is really your hour and your time to be able to ask any and all questions. So we welcome welcome any activity in the chat, and we'll do our best to make sure we get to all your questions. And just on the content warning piece, we know what we're talking about today can be a tough topic. Talking about mental health and suicidal thoughts and suicidal ideation is our tough topics. And if this is triggering in any way for you, making sure that you pay attention to yourself, pay attention to what you're needing, what your body is needing. And if you need to step away or take a break, that is completely fine. Just really make sure that we take care of ourselves as we go through our content today. And that being said, if you feel like you need immediate help, please call the crisis line that I've listed down below, or you can also call or text the National Suicide Hotline, which is 988. And more on the agenda for today. So today we're going to explore how to recognize mental health and substance use disorder symptoms. So we're going to be talking about the warning signs that somebody might be struggling with their mental health, kind of helping to open up our eyes and ears on what those symptoms are, as well as we're going to recognize when someone might be in crisis. And so once we then go through those symptoms, we'll then spend some time talking about how to have a supportive conversation. How do I sit across from somebody and talk about their mental health? Or how do I link that person into making sure we get them the help that they need? So we'll walk through all of that today. And before we get started, Marilee, I'm not sure if you wanted to take this one to kind of get some engagement amongst us.
And Nicole, thank you. And this is a lot of people that I work with in this space all have personal stories. And it's part of what drives us from a personal mission. And didn't know if anybody wanted to share what brought you here today. For me, I had somebody very close to me several years ago um, took his own life, and this has driven me in really being a sounding board and trying to make it different. And if I can make the difference for one person, that's important to me. So a lot of what we do in the National Labor Office is driven by that personal mission. I don't know if anybody in our audience would like to share their story or anything that's brought you here today.
Yeah, thank you so much for sharing that, Marilee. We'll make sure to kind of monitor the chat to see like how other folks are, what is resonating with other folks. And just in the vein of your vulnerability, I got into the field because substance use disorder runs in on both sides of my family. Lucky me. And so really making sure that folks that are struggling get the help that they need, because there's so much stigma around asking for help or recognizing that there's a problem. And so that's why I became one of the reasons why I became a therapist, was really making sure that if folks are struggling or not feeling their best selves, that they have somebody that they can go to. So I appreciate hearing your perspective there, Marilee.
Thank you. And one of the things for our audience today is Nicole have been and I have been discussing what can we all do? I'm not a
Mm-hmm.
clinician like Nicole is, but I have things that I can do to help others. So that's part of what we are going to talk about today, but a little bit of knowledge first
Yeah.
so
Yeah.
that we could be more effective.
I love that. Yeah, and actually that's perfectly tees me up for the next slide. And the kind of the goal here today is not that everyone walks away feeling like they have to become a therapist. If you want to, that's great, but you don't have to. And so leave that piece to the clinicians, but that doesn't mean that if you don't have a clinical license that you can't help people. So I love that call out. And I also like to start these presentations with just some facts, some numbers. And I don't share these to scare us or be doom and gloom, but to actually kind of start to build community and realize that if you're struggling, or if you know someone who is struggling, that they really truly aren't alone, and that it is very common throughout our lives that we're going to need help with our mental health in different ways. And in particular, how this affects union members. And so, what we are finding from clinical data is that folks in the construction industry, their suicide rate is 4 times the national average, which is really, really high. Um, and when it comes to healthcare workers, they're reporting 46% are feeling burnt out. And actually, that stat surprised me. I actually thought that it would be higher. And then, in particular, the transportation and manufacturing space, 1 in 10 workers are reporting heavy alcohol use. And so, really making sure that we encompass like why mental health is important, talking about it is important, and it's more than just um, a physical or mental health issue, that it can oftentimes be a safety issue too, depending on what that person does for work. And so, really making sure we kind of attack the mental health aspect from getting that person help because it's the right thing to do, but also really understanding the safety element of untreated mental health disorders or symptoms. And I'm probably, for the next slide, preaching to the choir here. You actually are all the experts in the workplace stressors, particularly when it comes to union jobs. And there's so many different risk factors that then contribute to those numbers that we saw on the last slide. And folks that and members that work union jobs, we know that it's physically demanding work and there's a high risk of injury. And they're oftentimes exposed to traumatic events like accidents that happen, emergencies that happen. And there's oftentimes still a stigma that if someone is struggling or if someone gets injured or isn't feeling their best selves, you have this like rub some dirt on it mentality, or just kind of push through the pain or the mental distress that you're feeling, which then makes that person feel worse and worse over time. And then some other factors that affect a person's mental health could be irregular shifts or long hours or working the overnight shifts, like really things that affect our day to day, affect our sleep, and then in turn affect our mental health. And another one that I feel like isn't always talked about in these presentations is job security concerns. So if there's contract disputes or fluctuating market demands for that person's job, not having a consistent schedule can really contribute to someone not feeling like their best selves and then increases that risk of mental health issues. And then kind of the theme that we'll gather here today is that while we've moved the needle a little bit, and I think as a society, we've gotten better at talking about mental health. There is still that stigma. And so that fear that if I raise my hand and say, I'm not feeling my best self, or I think I might be struggling with depression or anxiety, there's a fear that they might be reported for speaking up that then causes that person to kind of crawl back into their hole and not get the help that they need. So all of these things, like I said, I'm preaching to the choir here. You all are all the experts. I wanted to really lay the groundwork for why we're talking about mental health, particularly for those folks in union jobs.
And from a substance use, a lot of people are self-medicating instead of seeking the
100%.
help. So that's a question,
Yeah.
am I overcompensating or self-medicating?
Yeah. Oh, 1,000,000%. I love that call out. And we're definitely taking some time today to talk about the substance use issue. We would be remiss if we didn't talk about it. And again, teeing me up perfectly, Marilee, for the next slide of getting into when I keep saying mental health conditions, what do I mean? There's actually a whole book on mental health symptoms, and in the time that we have, we don't want to go through all of that. That would be a very boring presentation. But for the purposes of today, really wanting to highlight 4 common mental well-being conditions that we're going to be focusing on today. So that first one being anxiety. So what is anxiety? Really, at its core, an anxiety disorder, someone who is really truly struggling with anxiety, is characterized by persistent worry, persistent fear, and stress that really interferes with their everyday life. And I always like to highlight the difference between an anxiety disorder and feeling anxious. We all feel anxious. That's just unfortunately part of the human experience. And so the difference would be you might feel anxious before a job interview or maybe before a presentation, just like this. You kind of get the jitters, maybe your hands sweat a little bit, your heart races. But then after that interview or after that presentation, you kind of come back to baseline. You're able to calm down your nervous system. That's feeling anxious. But having anxiety and living with an anxiety disorder is that even after that presentation is over, even after you've nailed that job interview, your heart rate is still going 1,000,000 miles an hour. Your palms are still sweaty. It's affecting your sleep. It's affecting your ability to eat or exercise or show up as your best self. So I always like to differentiate between feeling anxious and having an anxiety disorder that maybe requires mental health attention. And then depression, that's also a term that we kind of throw around a lot, and it's because it's pretty common. And so at its core, the definition of depression is as a persistent low mood or feeling really fatigued. You have this like profound sadness that you oftentimes can't link to one or two things in your life. So those are really the prominent symptoms of depression. And the difference there is feeling depressed and having depression. So feeling depressed could be after that job interview that I thought I nailed, I didn't get it. And I'm feeling pretty upset about it. I'm feeling pretty sad, a little bit down on myself. Maybe take a couple of days to cry it out or, be mad, be irritated, and then you move along with your life. Those are kind of some normal symptoms to have when we don't get what we want or we're feeling sad about something that happened in our life. And then depression is those consistent feelings weeks or even months after an event that really affect our ability to be our best selves. we're having trouble getting out of bed. We might be skipping work or being late to work or just bursting out into tears for no reason. Again, kind of molding into the time where we might need to be able, we might want to seek mental health help. And then the main one that we'll be talking about today is substance use disorder that you alluded to Marilee, and that is the frequent use of alcohol or drugs that then impact a person's behavior and their day-to-day life. So just because someone uses substances doesn't mean it's a disorder. Someone could go to a work happy hour, have 2 drinks, go home and go to bed. That doesn't mean you have a substance use disorder. The disorder part comes when you start to have cravings, you start to put yourself in risky situations to acquire that substance, or you put yourself in risky situations while you're using that substance. You're thinking about how you're going to acquire that substance. You're thinking about the next time you can use it. And even though you've tried to stop or you've been asked to stop, there's an inability to stop using that substance. And then you might even experience withdrawal when you don't have the substance that you need. So we'll really double click on substance use disorder today, how to recognize it amongst ourselves or our friends or family, and then what to do about it. How do we have what can oftentimes be a tough conversation? And then the last one here that I know can be the most triggering for folks is suicidal thoughts and behaviors. And so I'll tee it up right now, and that's really thinking or making statements or actually having actions that are related to suicide. So just teeing that up right now, and we'll kind of shelve that for a little bit because we'll spend a whole section on really how to address the suicidal thoughts and behaviors during our time today. So feel free to use the chat if any of the examples I gave, or if you have any additional questions about the 4 symptoms or the 4 mental well-being conditions that we'll really focus on today.
And Nicole, I know a lot of us have spoken about these 4, conditions, but it's good to go through the definition because there is a line between kind of touching your big toe in something and really having an issue. And if we're all going to be armed in a position to really extend ourselves and look for solutions, we have to start at the baseline and defining this, not redefining, but just that basic awareness of the definitions is a helpful starting point.
Yeah. I totally agree. And that's, I think, where like the knowledge is power here, that sometimes we throw around terms like anxiety and depression, and really we don't know where they're coming from or really what that means. And so really having that definition can really start to help us understand, is this just like an understandable symptom that I'm feeling based on something that happened? We're all allowed to feel sad. We're allowed to feel anxious. Like that doesn't mean that we have a problem. And so kind of normalizing that aspect of the human experience. So then we can recognize, oof, this has actually maybe crossed over into really affecting my day-to-day life. And I need help kind of getting myself through this. I appreciate that call out. And then, as I mentioned, we're really going to be double clicking on substance use disorder today. And so if we move to the next slide, now that we have a better definition of substance use disorder, how do I recognize when a union member might be struggling or someone really important in our life might be struggling? So these are just a couple of symptoms that we can start to open our eyes and open our ears and be a little bit more aware and recognize when someone might not be feeling their best self. So it's molded over into someone just using a substance, like drinking occasional alcohol, into someone who's struggling when they have trouble cutting back, despite either wanting to stop or being advised by usually a spouse or a partner or an employer to cut back or stop. There's an inability to regulate themselves around that substance. And they continue to use it despite safety issues at work or at home, despite adverse effects to their health. They may be experiencing relationship problems and then are still using that substance. And some things to be aware of when it comes to the like work productivity is changes in attendance. So either that person is not showing up to work at all, maybe they're hungover, or they're coming late to work and they never used to do that before. And you're noticing issues with their productivity and then issues with safety compliance. Again, really remembering that mental health, when not addressed, becomes a safety issue. Other things to be aware of is someone who's struggling with substance use disorders, that they start to crave that substance. They start to crave the alcohol or the drug that they've been using, and then they need more of it to get the same effect. So they're starting to drink more, they're starting to smoke marijuana more to get the same feeling, the same kind of elated feeling that that substance gives them. Their tolerance is increasing. And when they stop using or they try to cut back, they often have withdrawal symptoms. So like the hangover effect when they don't have that substance, or that substance is leaving their body, which can lead that person to feeling lethargic, again, not showing up to work, can lead to anger issues, and even in the most severe cases, can lead to psychosis. And another thing to be aware of when someone might be struggling with substances is using it in a risky situation. So they might be impaired on the job, especially around like heavy machinery or climbing a tall ladder, and being impaired while doing so, or they're driving under the influence, or they're putting themselves in risky situations to acquire the substance. They're meeting someone sketchy in a parking lot to acquire the substance, or they're using it maybe when their kids are home because they can't stop themselves. So there's like risky use on the job, but then also on in the home too.
Nicole,
And
do you
then,
find that in some places acceptable risky use, I mean, sorry,
yeah,
risky behavior has been accepted in, so,
totally.
and I think we all have a responsibility to not just ignore it or to laugh it off or to condone it, right?
Yeah,
So you see, you're out with your buddy and then you see them get in a car, you got to say something. And so we
100%.
probably all couldn't think of scenarios where we didn't say something. And
Oh my God.
most of the
Yeah.
time it probably works out fine, but we have a responsibility. And I love the saying, I'd rather be uncomfortable than regretful.
I love that 100%, right? I'd rather be seen as like a little dramatic and, get it wrong than, be wrong. And I love that call up merrily of like not saying something when someone's having that risky behavior. I mean, I'm a therapist and I still get that like, oh, I know I should say something. It's tough. It can be really tough. Or kind of on the flip side too, the clients that I would work with when I was assessing them for a substance use disorder, they'd be like, well, but my friends drink just as much. Right. So it's kind of like normalizing the issue. And it's like, well, because you've done
Normalizing
a
it,
really
right?
great, yeah, you've done a really great job of surrounding yourself with folks that are also using this in a risky way too. So it can take a lot to kind of get that person out of that, helping them kind of see that just because your buddies are also drinking as much as you, that doesn't mean that they also maybe don't have a problem as well. So I love that call out. And then some things to keep in mind about about a substance use disorder, and we can actually move to the next slide, is that it can happen with substances that are legal and illegal. So it's not only illegal substances that contribute to a disorder, and there isn't a personality type that's more like likely to get one. There's some evidence that shows that there can be a genetic component, but it doesn't necessarily mean that because your parents are struggling with substances that you also will, or because your parents don't drink or don't use drugs, that doesn't mean that you also won't develop one. So while there's a link to genetics, it doesn't necessarily mean that you will or will not, get a substance use disorder in your life. And something that and it also doesn't discriminate. So it impacts all people of all racial, ethnic, and economic backgrounds. And sometimes when I would work with my clients and I would say, hey, like this is a problem. It needs to be addressed. The first thing I would get that would come out of their mouths was like, Nicole, I can't go to rehab. I don't have time. I can't afford it. And there's so much stigma around treatment that just because you're struggling with a substance use disorder, that automatically you have to go to rehab. And that's actually not the case for the vast majority of people, that there's actually so many more treatment options that people can do in the comfort of their own home. They don't have to go to a facility for 30, 60, 90 days. That can be really disruptive. Some folks might need that, but a lot of us can actually get really adequate, really great, best-in-class treatment from the comfort of our own home, through virtual outpatient treatment centers. And just kind of highlighting what that might even look like on the next slide is that there's no a single treatment that's appropriate for everybody. Again, on the really extreme end, we might need to think about detoxification programs or maybe rehab programs. But actually, the vast majority of people can get that treatment on an outpatient basis. So they can keep their jobs. They can pick up their kids from soccer practice. They can be a member of their community. They can sit with their kids and help with their homework at the kitchen table. They don't need to disrupt their entire life, but can still get treatment from the comfort of their own home, either through an outpatient program or individual therapy. So I always like to squish that myth that if you're listening and you're thinking, oof, I think I might have a problem with drinking or with drugs, I don't want you to leave this thinking I have to go to rehab. That it's worth exploring the options that you can do at home so you can still go to work and be around your family and friends.
And Nicole, a lot of what we've done in the industries, the payers have done in the industry, is increase access to providers that can help, but not swiping it with the same level for every single person, so that those clinicians and programs that are really extreme are delivered to those people who really need it. But the lion's share of people that need help, they're being able to have options for them that are more realistic, exactly what you're saying, more so that they don't move along the continuum to need the extreme.
Yeah, exactly right. And then because we really want to make sure that that treatment is really right sized to that person and what they're feeling. And if it is rehab, fine, we'll work with them on getting them a bed. But if it's not the right treatment and you go to rehab and it doesn't work for you and you come out and you relapse, we have that proverbial in and out of rehab that we hear from folks. And that's because that's not the right treatment option. And so you're not only not getting the help that you need, your substance use disorder is getting worse. And now you're out. I worked with a client once that was $500,000 in debt from rehab programs. And that's what keeps me up at night, is making sure that the treatment that we give to that person is really right size, so they don't have to go into debt to get well, to get better. So I love that is such an A+ call out there, Marilee, is really making sure we right size that treatment. And then, yeah, we're moving into more of the like suicidal ideation piece of our presentation today. So I'm sure, Marilee, if you wanted to tee us up for this
So
part.
one thing I was saying, you and I have been discussing is, it is a slippery slope for people that where we saw those healthcare conditions to go from something that's just a little depression. It is a very slippery slope and very quick for certain people to go into a suicidal ideation. And that's where we really want to capture people's attention and get that early intervention right away before it gets to that crisis scenario. So if someone's showing signs of this, what is it that we can do?
Yeah. I I think you hit the nail on the head. Is it's important to talk about it. That being said, also understanding how challenging it can be, but talking about and addressing suicidal thoughts and ideation head on actually saves lives. When I'd be working with my clients and I'd be kind of coaching them through how to recognize if someone's struggling with suicidal ideation, they'd be like, Nicole, I can't ask them if they're feeling suicidal. What if that implants the idea in their head to then move forward with it? And such a normal like concern to have, because we don't want to make things worse. But what's so interesting is actually clinical research and data is showing that the opposite is true. that when we address and we actually sit across from somebody and say, are you going to harm yourself? Are you thinking of ending your life? It actually contributes to them getting help. It does not, we do not implant the idea in people's brains. If they were thinking these thoughts, they're already thinking it. And so what we can do is actually be brave enough to address it head on, because we know that's what actually saves lives. It actually gives us the opportunity to connect that person into care, or just sit with them through the stuff. Sometimes when someone is really, really struggling, we feel like we have to immediately fix the problem, or what that person's actually just looking for is to feel heard, seen, and understood. And so sitting with them, I used to call it like sitting in the mud. Like, I'll sit in the mud with you, and we're just going to be, we're just going to exist. And I'm going to really fully see, hear, and understand what you're going through, so I can get you the help that you need.
Which is a good segue into what is the next step. Because once,
Yeah,
and also I've been trained to say, when you ask this person, are you thinking of suicide? You ask it as plain, non-emotional as you would say, do you want a cup of coffee? It
yeah.
shouldn't be couched with all this other stuff. It should be direct forward and not full of emotion, just very matter of fact.
Totally. Yeah, which is hard to do, right? Because it's an high emotional
Yeah.
topic. And so really remembering to like lower our own heart rates, be as calm, cool, and collected. Maybe on the inside, we're like, "Ah," but on the outside, making it a calm, welcoming space for someone to say, hey, Marilee, yeah, you're right. I am really struggling today. And not kind of not add to the anxiety, because we don't want that person to think that they've done anything wrong, because that then just leads to guilt. So I love that call out. I think it's also important, if we wanted to move to the next slide, of when we talk about suicidal ideation, a question that I would get a lot is, well, how do I really know? Which is a completely understandable question. And so there's some warning signs that we can be a little bit more attuned to. And so when it comes to somebody making outward statements about suicidal ideation or thoughts, the more obvious ones are if they start to write about, or they just verbally make statements about death, about dying, or about suicide. Those are kind of the more obvious signs or statements that someone is struggling. But the less obvious could be someone commenting about not having a reason to live, or having no purpose in life. That just can kind of get our alarm bells ringing just a bit. Or they're commenting about feeling trapped, or that they're feeling a huge burden to others. And some words to focus on and kind of be aware of are that person saying words like hopeless, or helpless, or worthless. That those are kind of some warning statements, that maybe that person is not feeling their best, and may actually be thinking or contemplating suicide. And they also have some behaviors that we can be aware of, and we'll show those on the next slide. So, acquiring the means to take someone's life. So, that could be purchasing firearms, or maybe they're accumulating pills. It can be hard to kind of catch, but that doesn't mean that we're completely helpless here. That really making sure that we're aware of some behaviors that are common when someone is thinking of ending their life. Or all of a sudden, they're socially isolating themselves. So maybe a once bubbly social person is really wishing to be left alone. And I don't mean left alone, go to your room to decompress after a tough day. That's actually really healthy. But this is a person that has completely shut themselves off from their work, from their family, from their friends. And that gut instinct that we have, that something is wrong, is starting to get louder. Or they're having like reckless or impulsive behaviors that can also be linked to substance use issues. And they're really engaging in self-destructive actions. So, kind of to your point, Marilee, of someone like drinking and driving and not saying anything, because it can be uncomfortable to feel like we're confronting somebody, but they're all of a sudden driving, 100 miles down the freeway while they're intoxicated, because they're like, if something happens, I don't care anymore. So it's kind of like that reckless behavior to keep our eyes and ears open. or we're really displaying dramatic shifts in mood swings. So oftentimes with suicide, if someone all of a sudden starts to feel or act really happy, we're like, oh, phew, great, Nicole's okay. But that actually could be because that person has made a plan and they see that the end is near. And so they get kind of this high and that kind of elated feeling. And so kind of just being aware of somebody who was maybe really isolated, really, really profoundly depressed, all of a sudden starts to feel more happy and joyous. That's actually a behavior sign. And a stat that keeps me up at night is that 80% of people that die by suicide have seen their doctor in the last 30 days. So people aren't, even medical professionals aren't asking, aren't talking about it, even if their gut is saying something might not be right with this person. That having that conversation can feel too tough. And unfortunately, by not having that conversation, they're more likely to complete suicide.
And it could be it could be very, very subtle that even
Yeah.
a professional can't even identify it.
Mhm.
So, and I also think that in this, when we're talking about behaviors, it it could be masked very easily too. So you might not see so much in the behaviors because people are able to mask it.
100%. And that's where we kind of fall back on like where that gut instinct, like our guts are pretty accurate. Like when something doesn't pass the sniff test, our guts are like, this doesn't feel right. And so to like kind of piggyback off that subtlety, if someone does something a little subtle that just piques your interest or doesn't feel quite right, really listening to ourselves and listening to our bodies and that gut instinct that something might not be right, because you're exactly right. It could be something really, really subtle.
Yeah. And the other thing that we spoke about earlier is that self-medicating. So if you see
Yes.
somebody step up with drinking more, whatever, they're self-medicating. It might not be what it appears to, on the surface. Oh, they're just out more, but maybe
Mm-hmm.
not.
Yep. Yep. 100%. That's a great
So I
call.
think this is a really good, and a lot of what we went over is probably what people know already, a lot of it, but it's building awareness so that it's at the tip of your tongue so that you can help the people around you, or if it's for yourself.
Mm-hmm. Yep. Exactly. Yeah. Exactly. And just as a reminder for folks that if you see something, say something, and we'll go through some common ways that somebody can, or those communication tactics that we can use if we do recognize someone's struggling, and helping them get help from a trained professional as quickly as possible. In no way is there an expectation that we're all going to leave here becoming therapists. It's not our job to solve people's problems. But it is our job to keep them safe. And so, really making sure we toe that line that if we do recognize someone is struggling, that again, we don't need to be their therapist, but we can link them to a therapist. And so, something like calling that 988, you can either call or text with someone that might be struggling, like right in the room, and just linking them to that trained professional. You don't have to yourself be that trained professional, and making sure that if somebody is suicidal, that we keep them safe, away from weapons, any sharp objects, and that encouraging them to call that suicide hotline, or if they're not in a space, saying something like, hey, can we call together? I'll actually be the one to dial, and we can be on speakerphone together, and I'll hold your hand through this. And then if we move to the next slide. I'm not sure, Mary. I think, Marilyn, we might have lost you for a bit, but
Yeah, I
I
just
think
lost
you're
power.
back.
Yeah, I think it's a
So,
1 for 1. Every time I do a webinar, I lose power. So
oh,
back on my phone.
of course.
So, okay. So now we're going to talk about when should we say something?
Yeah. So that's kind of like the $1 million question. It's like, well, how do I? Okay, now I know when there's more. And now I'm more aware of the statements or the behaviors that someone might be making, but when do I check in? So the next slide will kind of go through again, that trusting your gut. If you're noticing that someone isn't themselves, or there's a really noticeable change in that person, talking to them about it. I think, Marilee, you put it perfectly, that we would rather be wrong in having that conversation than being wrong by not having it and really missing something. I When I was getting my license, I was training in an elementary school, and so a couple of the kids that I worked with would come in and would have like, suicidal thoughts or ideation, and immediately would want to get them to an elevated level of care. And one of the teachers said something to me like, "Oh, Nicole, she's 13, she's just being dramatic." And that really struck with me because I was like, I would rather be a little dramatic than be wrong. Right. And so really making sure that if your gut instinct is telling you that something isn't right, listening to it. And then how do we have those supportive conversations? We've gone through the definitions, we've gone through some examples. How do we equip everyone on this call to be a little bit better in having these, what can be a tough conversation? So this is more of like kind of transitioning now to the how-to part, the takeaways of our time together. So when we know that we have to, or it's the best thing to talk to a person that might be struggling with their mental health, with substances, suicidal ideation, is making sure that we prepare ourselves, that we do our self-care first. So I would recommend giving ourselves at least 10 minutes, ideally more, to take care of ourselves. That could mean going for a walk around the block, doing deep breathing exercises, making sure we eat something or that we drink water, that we go to the bathroom, that there's just things that we do to make sure that we're regulated to be able to have what can be a tough conversation. And making sure that we block enough time for the conversation. There's no hard and fast rule. If you have 45 minutes to an hour, that's great. There's nothing worse than your next appointment coming in right as you're talking about someone's mental health with the person that you're talking to, but making sure you block enough time to give that person to give that person space to be able to talk about whatever is on their mind. And creating some psychological safety, really making sure that it's in a private space. So the break room, a job trailer, a quiet corner, or even calling them on the phone when you're at home and you know they're at home. So there's no risk that a colleague can accidentally overhear. So making sure it's that private space. And we eliminate distractions. So we mute our phones, we turn off email notifications. Nothing worse than the ding ding of your cell phone when someone's sitting in front of you, maybe being emotive and crying about how they're feeling, and then hearing your cell phone go off. So really making sure we kind of mute those distractions so we can kind of prepare the space for a conversation. And to really reiterate and drive home, it's our job to have the conversation and learn and listen, but not to fix. We are not the ones that are fixing the problem. We're just guiding that person into the right care that they need, and we're being a friend. So some ways that we can do this is by listening without making assumptions or trying to solve the problem. There was one lady that I worked with when I worked for the state. I worked for the state of California, and really, really in the depths of alcohol use disorder, to the point where she would oversleep and then not be able to drive her kids to school on time, or would forget to pick up her kids. And some of my colleagues had a lot of judgment against her for that. And while, of course, that this issue needs to be resolved, going in with a judgment or thinking that she's a bad person or a bad mom doesn't help the problem, where it's rather having just an understanding and listening to what she's going through, and really suspending our own judgments and leaving it at the door. And no hard and fast rule here, but trying to minimize the time that we spend speaking. This is about the other person. And so it's, again, no hard and fast rule, but if we could try to speak about 20% or less, and really opening the floor for that person to be able to talk about how they're feeling, how long they've been feeling this way, and maybe what they're needing. And if a person doesn't want to talk, that's okay. We don't want to force them. We maybe aren't the right person, or maybe they don't feel safe with us to be able to talk with us directly, but maybe they're okay talking to another colleague. It's totally fine and it's really not personal. But letting that person know that we're there for them if they change their mind or if they do need you. And also asking for permission to check in, something like, hey, Nicole, I completely hear you and respect that you're not ready to talk right now. Is it okay if I check in with you in a couple weeks just to see how you're doing? Maybe we can grab some coffee. And asking for permission to check in again. It can be really, really empowering for that other person. And sometimes self-disclosure can be huge. We don't have to, and we get to leave it up to our best judgment. But if you're comfortable with that person, you can share a personal example to kind of join with them and help them realize they're not alone. So something simple like, hey, Nicole, a few years ago, I wanted to let you know I was actually really struggling with depression and I wasn't feeling like myself. And I was able to find a therapist and he really helped me. And I feel a lot better now. It really helped me get back on track. I just wanted to share that. Just wanted to share that with you. So, really kind of giving a personal example, if we feel comfortable, can really help that person and remind them, oh, right, like I'm not alone and there is help that is out there. And because I love a good takeaway, you'll get all these slides after, but if you want to take a screenshot, this is the one to take a screenshot of and just kind of conversation ideas for us to keep in our back pocket for when we have these conversation ideas. So starting with the unhelpful ways, and I'm sure we all know and we all recognize that somebody, what doesn't work and what can maybe alienate a person. And that would saying things like, I know what you're going through and I know exactly how you feel. Like, ugh, ick. That doesn't feel good, right? It doesn't, it makes it about us, not the other person. Or saying something like, just ignore it and move on, you'll get better. Kind of feels a little dismissive, right? Or saying things like, it could be worse or other people have it worse than you. Grief and depression and anxiety, substance use, it's not a competition. You don't get an award because you're feeling the worst. There'll always be people that are going through different experiences. And so saying it could be worse just really isn't helpful, right? And then on the flip side, what is really helpful could be saying things like, hey, Nicole, I've realized you haven't been joining us for our morning coffee breaks. How are you doing? How are things? Or something like, you seem a little distracted. Is there something on your mind? If there is, I'd be really happy to listen. And then if someone does disclose, saying something like, how long have you been feeling this way? Or something like, hey, Nicole, I remember a couple of years ago you mentioned you weren't feeling your best self. What did you do then that helped you kind of get through it? What did you learn that maybe we can try again now? Or maybe for a colleague that isn't as engaged or a person in our life that just isn't as engaged, actually just calling it out, like kind of like you said so beautifully, Marilee, just calling it like it is. Hey, I've noticed you seem less engaged during our meetings or our safety checks. How are you doing? Any chance you want to grab a couple minutes and talk? Really simple. It doesn't have to be this whole big thing. Like I said, feel free to take a screenshot of this. You have like some conversation ideas so you know how to best approach a colleague that might be struggling. And I'm sure, Marilee, kind of in your experiences, have you seen like conversation ideas like this be an effective route to address when someone might be struggling?
Yes, and I think it's just coming up with a line. What's the opening
Mm,
line of what you're going to do? Because if you're armed with that, I think it's easier. I also have seen within the trades, they've produced these 988 chips,
mm,
coins, which has the suicide line and it usually says we care, and leaving it discreetly for somebody, or I've seen that as a best practice if you're struggling with how to start the conversation. It could be as simple as leaving them a note or giving them one of those
mm.
chips. So the point is to get the conversation started. And the other thing too is we are recording this how-to webinar today, which you can feel free to pass along to people as well. That can help get the conversation going. Maybe not somebody who has a suicidal ideology because it's not quick enough to have the conversation, but it is something that we hope that other people will hand off to others to replay in this how-to, what to be aware of, and that there is help and access. And the other piece I wanted to mention is, there's coverage for mental health. We know that. We know that our legislators are trying to put with mental health parity access. All the carriers, not just Blue Cross Blue Shield, are trying to spread access. Spring Health, you're coming up with innovative ways for people to have access, whether it's the comfort of their own home.
Yeah.
But our call to action here is that we're all guardians, so to speak. And if we all take a part in just trying to get the conversation going, it is our hope that we will have greater success and really hit those statistics to improve them.
Yeah, that's incredible. And I love your ideas too, especially the discrete piece of it. Like, we don't want to unintentionally embarrass that person. Sometimes the discrete piece is like the way that we can kind of get them to engage. And something really simple that Spring does is we'll often go on site, like a construction site, for example, and we'll put flyers in the back of bathroom stalls, like with a link to support or the 988 number. So when somebody kind of is in the privacy of their own stall, they can like get the information that they need, and no one will see them writing down the number or maybe scanning a QR code. So it's just a way for folks to be able to get access to services without anybody seeing that they're doing that. So I love your tips and best practices for that discrete piece as well. So I think
Nicole,
yeah.
we're about towards the end. So any last words from you?
Yeah, well, first, I wanted to just like thank everybody that logged in. As we had talked about in the beginning, talking about mental health and talking about substance use and suicidal ideation are really tough topics. And so I really appreciate that you tuned in, that you listened, and hopefully got a couple of takeaways that we can start to help our colleagues and our friends. So hats off to all of you for participating and learning a new skill today. I really appreciate it. We've all had different mornings and afternoons, and life can get chaotic. And so to be able to be in the same space with all of you has been, a true honor. And thank you for letting me lead this presentation.
Thank you, Nicole. And we don't have time right now for questions, but what we'd like you to do is submit your questions in the chat. We will take them and push them out to everybody. And please take this recording that we're going to send you as well and share it with everybody. The point is that there isn't a miracle cure here. What it is working together to build awareness and to show humanity that we care for people. And when, for my own personal situation, the person I knew, when he took his own life, he was young. It affected so many people around us. So we would have rather have just helped him at that point than have all of us in this situation. So that's what we're trying to do, is spread that awareness that it could be that simple as just asking somebody a simple question. And there is access to affordable healthcare for everybody, whether it's through your fund or a different plan. The point is that all you have to do is ask the question.
Yeah, I love that. Thank you.
Thank you all. Have a great day.